I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're going to look at facial contouring for feminization using neurotoxins and dermal fillers. Many people want to make their face appear more feminine by changing their facial appearance, and there are several ways that this can be accomplished. But first, what are the features that just seem to scream male when we see somebody across a room? And these would include a higher forehead in a male, higher and wider forehead. The male hairline tends to be higher with less hair at the temples. Certainly a receding hairline or balding will identify somebody as male. Prominent brow bone, so a prominent brow arch here, and prominent brows will tend to look male. A prominent jaw or square or angular jaw can make a person look quite male. And then, of course, there's the Adam's apple. Most of the features that will make us look either more male or more female start with the bones of the skull. So let's take a look at the skull bones and the differences in anatomy between people who are born male and born female. Let me enlarge this picture. These are slides taken from Dr. Osterhout's collection, and you can see at the left, this is a male skull. On the right is a female skull. Let's take a look at the brow initially. Notice how much more prominent the brow is in the male. Then take a look at the jaw. See how much more square it is, and also how much broader it is. We talk about a strong jaw. Well, that's a good example of one there. There are many ways to make a face appear more feminine. We can use cosmetics to help contour the face, but accentuating the features that we want people to notice and playing down the features that we don't want people to see. Hairstyling can make a difference. FFS, or facial feminization surgery, is a way to modify the facial features permanently. But we also have neurotoxins like Botox and dermal fillers like Juvederm, for example, for shorter term changes that are ultimately reversible. So what are neurotoxins and what are dermal fillers? Well, neurotoxins, this is botulinum toxin that is injected into specific muscle groups to relax these muscles, and they'll make an area look smoother and often younger. So just on my own face, I can show you this area here in the middle of the forehead between the brows is called the glabellar area. When we frown like that, you can see that those areas can look angry or look older. If we inject Botox into the areas right up here, for example, like in this area, what can happen is that a person will look more relaxed, they'll look less tired, and oftentimes people will say that they look younger. So that's what Botox or neurotoxins do. On the other hand, we have dermal fillers. Now, one very common form of dermal filler is made with hyaluronic acid, which is something that we have in our skin anyway, but it can come with varying degrees of viscosity or thickness, and that can give us more or less filling to an area of the face. What fillers do is to add volume to an area of the face. They can fill in lines that make us look older. As an example, let me show you that a filler on my own face, I don't have anything in, but a filler might be placed up in this area to make this area elevate a little bit. Let me show you. Okay, so if this elevates, notice how that's going to reduce. It will reduce the nasolabial folds here. It reduces the marionette lines of the chin, and overall, it's going to make me appear younger. On my face, for example, I don't have a broad jaw. It's just that I have a lot of volume loss from being 72. But see, this would be what fillers would do. Well, kind of. In any event,